Good morning and afternoon, everyone. Welcome to this session titled Are Scale and Cost Effectiveness Correlated? The short description of this session today is many believe that global health interventions are inherently scalable with increasing cost efficiency thanks to economies of scale. In this presentation, Tony Senanayake, the CEO of Fortify Health, will share details of the growth journey of Fortify Health and how they have thought about scale and cost effectiveness. Brief description of the group. Fortify Health is a rapidly scaling nonprofit working to reduce iron deficiency anemia in India by making wheat flour fortification easy for millers and governments. The organization partners with industrial scale mills across more than a dozen states, providing a hassle-free bundle of premix, equipment, training, and quality assurance support. Its approach is grounded in cost effectiveness, rigorous monitoring, and a doer at scale, payer at scale strategy that ultimately aims to hand over fortification to government systems. Fortify Health currently supports fortification reaching roughly 11 to 12 million people each month, with a pathway to national level policy change. The team is building and the enabling environment, technical, political, and operational, that could make wheat flour fortification a sustained, system-wide solution to anemia in India. Now, a brief biography on Tony's background. Tony Senanayake is the CEO of Fortify Health. Uh, he brings a background in global health, management consulting, and evidence-driven strategy with previous roles at ID Insight and an MBA from Yale School of Management. His work focuses on building organizations and systems that can scale cost effectively, with a particular interest in political economy, measurement, and operational design. Tony is a Rayner Arnold Fellow with the Mulago Foundation, where he has deepened his practice in scaling frameworks and uncertainty-driven strategy. He is motivated by the belief that simple, well-executed interventions can generate transformational impact when implemented well. As a reminder, for all, if you have questions for our speakers, you can submit them via the Swapcard app. I'll be selecting a mix of your questions and some prepared ones during our Q&A. We'll also have office hours immediately following the session and get around for continued discussion. Please join me in welcoming Tony Sinayanka to the stage.
Thanks so much, Sue, for the kind introduction. And good afternoon, good evening, good morning to all of you. 6 years ago, I was part of a university group that introduced me to the concepts of effective altruism. At that point in time, I found many of these concepts deeply persuasive, but honestly, I also found them to be quite philosophical and abstract in nature. Over these last 6 years, I've had an opportunity to start putting some of these frameworks into practice. And I hope over the course of the next hour to be able to share how some of these different EA-based frameworks have helped inform not just my career, but the work that I do through the organization I lead called Fortify Health. At the same time, I also do want to highlight some of these situations where some of these frameworks may have led to some counterintuitive results as well. So as Zoo shared, I currently lead an organization called Fortify Health, and it is built on the core framework of impact, tractability, and neglectedness. 8 years ago, the founders of the organization, Dr. Brendan Eppen and Ms. Nikita Patel, conducted a landscape analysis to try and find interventions around the world that had great opportunity for impact, where there was a significant evidence-based that there be solutions that were tractable, and also where there was a lack of other organizations or interventions being implemented on the ground, or neglectedness. What they found was that anemia in India was a major challenge. Now, for those who may not be aware, anemia is a condition where there's a lack of oxygen in one's red blood cells, and it leads to a wide range of challenges. It can lead to chronic tiredness, fatigue, low mood. It can impair cognitive development. And perhaps most is that it's one of the major causes of maternal death. All in all, when one suffers from anemia, they are unable to fulfill their potential. And in India, it is estimated that it is costing the country more than $25 billion each year. Now, this makes sense when I share the number of people who suffer from anemia. The most recent Government of India survey found that over 2/3 of children between the age of 6 months and 5 years were suffering from anemia. 2/3. And when you consider that someone who's suffering from anemia is unable to reach their full potential, their brain development may be limited. They may not be able to reach their full physical potential. These early years in one's life are absolutely vital. And anemia is crumbling those frameworks. So clearly, there is a need, an opportunity for impact. But that's only one of the 3 elements of the framework. The second is tractability. Now, one of the things that one can do to try and deal with anemia is something called fortification. Fortification is the addition of key micronutrients such as iron, folic acid, and vitamin B12 into existing food staples, food that people eat on a daily basis. Now, to be clear, fortification isn't the final solution to anemia. The final solution is a diverse, nutritious, rich diet. However, in many countries, India included, such a diverse diet is not available to vast tracts of the population. And that's when interventions such as fortification, biofortification, and supplementation become relevant. Now, fortification has a significant evidence base. There are multiple meta-analyses that have been conducted over decades that show that if someone is consuming fortified food over a period of time, it reduces the likelihood that they will suffer from anemia. Secondly, it's incredibly scalable and easy to implement. And I'll share shortly how we at Fortify Health have proven this out. Third, it doesn't require any behavior change. Now, this is absolutely crucial. One of the hardest things to do in any global health intervention is change how someone behaves, be it asking them to exercise more, change their nutrition. All of these things are very, very sticky. Just imagine in your own lives. One of the joys of fortification is no behavior change is required because people are already consuming these food staples like rice, wheat, oil, and salt on a daily basis through existing supply chains. So long as we can make that one little change in the food system by adding those micronutrients, everything else stays the same. And finally, fortification is incredibly cost-effective. And I'll talk more about that in a moment with actual data from the work we are doing at Fortify Health. Now, once again, impact is important, but not sufficient. Second, is there a solution, which means that the problem is tractable? In this case, we do believe there is, that solution being fortification. But that is, once again, insufficient. If there are many other organizations and people already implementing the intervention, then it doesn't really make sense for someone else to come in and create competition in that marketplace. However, the founders of Fortify Health realized that there were no other organizations working on the ground in India to support the fortification of wheat flour. And consequently, all 3 of the elements were met, and Fortify Health was founded approximately 8 years ago. We are a team now of almost 100 professionals, largely residing in India, but also with folks around the world, who are all focused on tackling this problem. And our fundamental mission is to reduce iron deficiency anemia, very simply. As an organization, the way we go about doing this is we provide the necessary inputs, including relationships to institutions, the necessary equipment and materials, as well as key financial resources at the early stage of a mill switching from unfortified to fortified. And what this means is that millers who are already selling their products now sell fortified instead of unfortified, thanks to our support. This wheat flour then goes into the marketplace using existing distribution and retail channels. And it is estimated that if someone consumes fortified wheat flour on a daily basis, it leads to a 27 to 41% population reduction in anemia, a huge figure. With the final goal that stunted, limited development, that inability for one to reach their full potential is no longer the case. And people can reach that full potential that they have at birth. As an organization, we are now working across 16 states in India, all the states that consume wheat flour, with a three-pronged approach. We engage directly now with over 200, almost 250 mills, and fortify some 60,000 metric tons of wheat flour each month. Figures that have grown by more than 2 times in just the last year alone, as you can see by this graph. Last month, we estimated that we reached actually 13 million beneficiaries across India. We estimate, thanks to that work, that last month we averted some 3,000 years that people would have suffered with anemia. However, one thing that we have learned through our journey is that implementing this intervention directly with private sector mills is great, but limited. Our focus as we shift forward as an organization is thinking about how we can engage government partners to support them in distributing fortified wheat flour through existing welfare programs. Now, if you're unaware, in India, almost 800 million people get some meal during the week from a government social safety net program, be it a child who receives a midday meal to an individual who is living below the poverty line, getting free rations from the government. And as a result, if we are able to shift the government's policy from distributing unfortified to fortified wheat flour, we have the ability to reach many hundreds of millions of people, most of whom are much more likely to be suffering from anemia. And that is what we're really focusing on as an organization as we shift into the next phase of our growth journey. And I think this is perhaps one area where the ITN framework, that impact, tractability, and neglectedness, may have some gaps. As an organization up to this point in time, we have been very focused on cost effectiveness and reaching as many people as possible. But one of the challenges when engaging with government is that this type of activity is very hard to measure, does not sit nicely on a theory of change, and at least in the short term is often cost ineffective. We can spend a lot of time and money engaging with political actors, be it ministers, politicians, or senior bureaucrats, to persuade them to take on a new policy or support them in a policy goal they already have. And I think as we consider really transformational economic growth and changes in health systems, we perhaps need to be a little bit careful of being too dogmatic about short-term cost effectiveness at the expense of long-term transformational scalable change. As an organization at Fortify Health, we're trying to straddle both while supporting open market mills and leveraging those partnerships to engage in policy change, but recognizing that at least in the short term, some of that policy work may not be the most cost effective. Encouragingly, we have been seeing some great successes in our work with government. We are now in partnership with the state government of Punjab, a state in the northwest of the country. We are working with a number of different companies to support fortification through their canteens for their workers. And perhaps most excitingly, we are currently working with the midday meal scheme in the state of Gujarat, a western state in the country. We are now reaching some 500,000 children on a daily basis with fortified wheat flour. And it looks like that may expand over the course of the next few years to reaching almost 2.5 million children each day. The legwork and the policy advocacy required in the early stages of engaging with government was not cost effective. However, these types of transformational changes, we believe, can drive really meaningful, scalable change in the long term. And all the work we do as an organization is grounded in evidence and data. This is something that we believe very strongly in, and I think matches well with the effective altruism mindset. We have various research partnerships with key institutions and academic organizations in India. And we also are currently going through a study with ID Insight to better understand who we are reaching and how they are consuming fortified wheat flour on the ground. Last year, we reached each beneficiary for 22 cents for a year. In other words, to shift an individual from unfortified to fortified costs less than 25 US cents. This leads to an estimated cost effectiveness based on GiveWell calculations of over 19 times cash, a figure that's improved by over 3 times over the course of the last year, thanks to increased economies of scale and strategic expansion of our work around the country. But I do want to note that this does come with various challenges. First, quality challenges. It is really difficult to determine how much of a micronutrient is added to a fortified product. And so to try and combat this, we are now leveraging AI technologies to use optical recognition with a chemical reagent to estimate how much added iron is in a fortified wheat flour sample. If we can unlock this, it will allow for real-time testing and quality assurance to ensure that beneficiaries are receiving the highest quality fortified products possible. Currently, the process takes 2 to 3 weeks and costs upwards of 15 to 20 US dollars for a single sample. So this would be a game changer for us. Second, large-scale food fortification is a population-wide intervention, especially when passed through an open market channel. So we do have uncertainties on whether or not we are reaching the people who are most at need. The current study with ID Insight will give us some greater information on who we are reaching, but there's still going to be significant uncertainties, and it is part of the reason we wish to focus more on government partnerships, which may be better at targeting. And finally, right now, we provide significant support to our mills to encourage them to go from unfortified to fortified. Moving forward, we plan to experiment with different approaches to see if mills themselves are willing to take on more and more of the financial and regulatory burden of fortification. Our hope is that through policy change at the government level, the millers will be self-incentivized to take on these changes without financial incentive from our organization. So this is something of a summary of the work that we are doing, but I want to share maybe 3 step-back learnings from this whole process. The first is that the EA principles of impact, tractability, and neglectedness, I do believe, continue to provide an extremely powerful framework for identifying effective opportunities, both as an individual and as an organization. Many AIM-incubated charities, formerly known as charity entrepreneurship, these organizations were identified using this framework and have gone on to have really meaningful impacts around the world. And so I often come back to this ITN framework to help me think through force prioritization and also to reconsider whether the work that we are doing as an organization continues to be necessary in the current environment. A second learning, as I shared, there is a risk that if we focus too much on cost effectiveness, especially in the early stages of experimentation, it can stifle the development of stable, scalable, cost-effective interventions in the long term. Experimentation, research and development is inherently costly. And impact can be very amorphous and can take a long time. I do believe personally that investment in the early stages is often worthwhile for impact further down the line. And so I do think we must be careful about not overly indexing on cost effectiveness until we really have identified a proof of concept intervention that is worthwhile scaling. And the final learning that I've had through this journey is that impact comes from implementation and not just good intentions. And I think this is something that really sits at the core of effective altruism. We all are very well intentioned, but this is a movement built on action. Be that action in terms of giving, be that action in terms of doing. And this is something which always brings me back to this movement. It is much more than just talk. It's about implementation and doing. And an experimental mindset and a willingness to take risks and get things wrong is perfectly fine. And I find it really admirable within this movement. And so with that, I'll happily take any questions you may have.
That, that was that. Thank you for the. Thank you so much, Tony, Senanayake, for that very insightful, very thought-provoking presentation. We now have some time for questions, and I'm going through Swapcard right now. Um, I'm just refreshing, just making sure that there are no new questions. Looks like the audience is still warming up to it, so that we have no questions at the moment, but I have some prepared. Um, yeah, so let's get started with the first one. Um, this is more on the efficiency gap that you mentioned. Tony, I wonder if you could double click on this. So you mentioned that currently about 85% of the flour is fortified effectively, and you discount your impact calculations to account for the gap. My question is, what are the primary drivers of that 15% failure rate? You might have touched it sufficiently, but I would love to hear you double clicking on it. Is it mechanical failures at the mills? Is it compliance issues with the staff? Or is it supply chain leakages? What are the marginal costs of like closing that final 15% gap?
Yeah, so when we think about quality challenges, there's two ends. There's situations where wheat flour may have insufficient levels of micronutrients, or where they may have too much micronutrients.
Mm,
And these are very different challenges. If there's insufficient micronutrients, then we are not having the impact that we desire. If there's too much micronutrients, then there's a risk of toxicity. Iron toxicity is very real. One can get quite sick, and it can be poisonous if you eat too much iron. Now, the actual underlying causes as to why something may be below or above, we actually have 21 different causes. But what we've observed, generally speaking, is that in the first couple of months of a mill fortifying wheat flour, it takes some time to calibrate the machinery. We are adding parts per million of micronutrients. A tiny, tiny proportion is being added. And so calibrating that machinery to ensure that the right parts per million are being added does take some technical expertise, both from our team, but also the training of the mill staff themselves. So that tends to be the main challenge that we face, is in those first couple of months, essentially the first 3 months of working with a partner mill, ensuring that we can calibrate quickly. And that's part of the reason we're particularly excited about this AI tool. Is right now the response times are up to a month. They produce, they have a sample, they send a sample to a lab, we get the results, we calibrate. If we can cut down that turnaround time to almost real time within a day, it will allow us to shift that calibration period from 3 months to significantly less, and consequently get that 85% figure to hopefully much, much higher.
Gotcha, Tony. Yeah. I can only imagine like the amount of battle tested answers, battle tested experiences y'all had. So I'm gonna try to unearth some insights that people the audience watching might be interested in. Um, My next question is about the cost effectiveness trap that you mentioned in your second lesson. Uh, you explicitly noted that there was a risk of too much focus on the cost effectiveness early on that's might have stifled the development of scalable interventions. Um, this is obviously, as you mentioned, quite a counterintuitive take for an organization built on effective altruism principles. My question for you is like, can you share another concrete example of a decision that or situation that Fortify Health faced that made um, that might have looked inefficient or expensive on a spreadsheet at the time, but turned out to be like absolutely necessary for the scale you have achieved today? Just asking for another concrete example of that happening. Um,
Yeah, so I think two things actually that I will highlight here.
mm,
It's investing in leaders and investing in operations.
mm,
Uh, when I shared before that impact comes from implementation, not good intent, this is a core part of it. Running nonprofit organizations in many ways is not dissimilar to running a private organization. Private organizations may be optimizing for profit maximization. We are optimizing for impact maximization, cost-effective impact maximization. And private sector organizations have realized the importance of investing in their people early, especially in leaders and future leaders, and also investing in operational systems. So 3 years ago, when we really started the scaling journey, we received a large grant, a generous grant from GiveWell to scale up our intervention. Two things that the organization invested in right at the start were operational systems and hiring high quality leaders before they were perhaps needed for the size of the organization we were. At the start, this definitely dinged our cost effectiveness, at least in terms of a cost effectiveness analysis, GiveWell style. But now we sit 3 years later, and these operational systems, things like hiring systems, performance evaluation systems, travel systems, CRMs, customer relationship management, ERP systems, all of this stuff, which is really not sexy at all, lays the groundwork for a high functioning organization. And the same goes for leaders. It takes time for leaders to embed themselves in an organization, build relationships, figure out their ways of working. And so hiring people, especially leaders, before you necessarily need them on the ground has been an investment that has paid dividends.
Thanks, Tony. Thank you for those answers. I'm squinting my eyes now because I just hit refresh and I was like flooded with a good number of questions. So let's get to audience questions. The first one I have is from Sakshi Mohan. Could you comment on the different perspectives in terms of impact metrics that governments or policy partners respond to, and the metrics that you as an organization value? I'm gonna put it in the Zoom chat as well, just so yeah, I can repeat myself as well if you need.
I think this is a fantastic question. So when we as an organization think about what a government actor or policy actor cares about, we are heavily persuaded by what's called the Malago framework. It comes from Malago Foundation. And there are 4 elements to this framework: good enough, big enough, simple enough, and cheap enough. The idea is that if a policymaker believes that a problem is big enough, the solution is cheap enough, simple enough, and good enough, then that's essentially what you need to get to for that policymaker to make the decision. Big enough, simple enough, cheap enough, and good enough. And the really critical word there is enough. There is no cash multiple bar here. This is a subjective determination by the decision maker who has the power for that policy decision. And so we as an organization, when we think about how we engage with policymakers, be it principal secretaries, who are sort of the senior most technocrats in the system, or ministers or politicians, what we try to understand is, what do they believe would be good enough, simple enough, cheap enough, and what do they think would be big enough to justify their political investment? And this will be different for different people.
Mm.
And we found this framework to be incredibly helpful. Because internally, I think as Sakshi noted, we have different benchmarks. For us, good enough, what is a strong enough evidence base, is likely to be very different to what GiveWell thinks an appropriate evidence base is, and extremely different to what a politician thinks a good enough evidence base is. That politician may care much more about what does their professor friend think about the intervention, as opposed to some systematic review conducted by Cochrane. So when we think about policy partners, we do a lot of empathizing. We do a lot of time researching who that partner is and trying to tailor our advice to them.
Thanks, Tony. I have a follow-up question to that that's related that an audience Kaushik Toda asked. The follow-up question is, and I'm going to put it in the Zoom chat for you. Can you give us a framework to decide on which interventions or ideas or programs to scale? Like, are there any broad general principles that guide our decision making?
Once again, I'm going to use the Malago framework. So I think Malago Foundation is some of the smartest thinkers when it comes to scale. And one thing that they focus on is that in order for an idea to scale, you need to know who is going to be the doer at scale and who is going to be the payer at scale. And when we talk about scale, we're thinking big. So the ITN framework can give you great ideas, interventions that could be great. But then to really think about whether those ideas are scalable, we need to think who actually is going to do that thing at scale. Is it going to be you, Mr. or Mrs. Nonprofit, reaching out to hundreds of millions of people? Is it going to be private sector actors? Is it going to be other nonprofits? Or is it going to be government? That's the first thing you need to think about. Who is actually going to do this thing at scale? Because many interventions are not suited for a government to do at scale, or many interventions are not well suited for a single nonprofit to do at scale. So really thinking about the doer at scale, and hand in hand with that is who is going to pay for this thing at scale. In our current philanthropic environment, philanthropy is no longer the payer at scale. With the end of US aid and the downsizing of multinational philanthropy, there are very, very, very few interventions where it's truly philanthropy paying for something at scale. Maybe the one example I can see are technology interventions, where one can reach huge numbers of people for very minimal marginal cost. So then we need to think who can actually legitimately pay for things at scale. One is the government. Governments can pay for true scale. Government spending, even in low and lower middle income countries, far, far, far outweighs philanthropy by orders of magnitude, 100 times plus. So we always need to remember that government spending is way bigger than anything that philanthropy can do, way bigger than any open fill or coefficient giving, or GiveWell or Founders Pledge. They're orders of magnitude larger. So can the government pay for it? Can consumers pay for it? Can you develop a solution which consumers can pay for? Or do you really think your idea is something that only philanthropy can pay for? And if so, you need to design that intervention very carefully. So the doers and payers at scale, I think, is really critical to add on to that ITN framework.
Thanks, Tony. Then the next quick 20-second clarification question. I'm seeing some drumming of potential confusion among the crowd of like when what you meant about the cost effectiveness lesson. So we have Ariane asking just a quick 20-second clarification question for you, Tony. So the argument is not that cost effectiveness is an insufficient measure, but that we need to lengthen the time horizon. Is that a fair paraphrase, or are we missing something you said?
I think I would partially agree with that and partially disagree with that. I partially agree that, yes, this is a function of not over-investing in the short term for long-term gain. But the reason I would slightly disagree with that is we need to think about who the payer at scale is. And if the payer at scale is consumers or government, then actually cost effectiveness is less important than the concept of cheap enough. because many governments and consumers are willing to pay for things which may not be cost effective. We as consumers on a daily basis pay for stuff that is not cost effective, but we pay for it.
Yep.
And so cost effectiveness as a single measure, I think, can be somewhat problematic, even on a larger time scale, especially if it's not philanthropy who could truly pay for that idea at scale. Better to design something the government could pay for, even if it is less cost efficient.
Yeah, that makes sense, Tony. And then I'm going to switch gears to a slightly more technical question that has great upvotes in the Swapcard. So 21 to we have Luis Fernandez asking 21 to 47% reduction in anemia for those consuming fortified flour is very substantial, but far from complete. What are the obstacles in increasing what percentage? Isn't it enough to add more supplement for to the flour? Is a limited amount of fortification a choice to maximize effectiveness given limited funds, or is the effect of fortification intrinsically limited?
This is a fantastic question, and it's not something I touched on, and I'm glad has come up. We consider fortification as a reducing intervention, not a preventative health intervention. There are a number of individuals, particularly pregnant and lactating women and many menstruating women, for which fortification will never be sufficient. And that's when supplementation becomes a more preventative measure. Fortification by its nature reaches everyone. It reaches me. I am not anemic. It reaches my wife, who is currently nursing, who is slightly anemic. And so when we think about fortification, it must be healthy and appropriate for everyone in a population, irrespective of how much iron is already in their bloodstream. So that's why we see something like 27 to 41%. It is a healthy level to add. It doesn't risk someone like me having issues with iron toxicity. It can support individuals who are mildly anemic, but we want to be very clear. It is not a panacea for people who are acutely severely anemic. Supplementation truly is the best preventative health measure for them, if not, of course, dietary diversification, but recognizing that there are a lot of obstacles to that, particularly in the short term.
Is your long term there's a never mind. I'm reprioritizing the questions. So there's a question by Siddharth Raf that asks, and I'm going to put in the Zoom chat. Is there a market understanding slash acceptance slash hesitance about fortified products? Does Fortify Health do any communication work for improving consumer confidence or use consumer pressure to make mills adopt fortification?
Once again, phenomenal question. And the very honest answer to this is that awareness of fortified food products, at least in India, is extremely low. Now, there are two schools of argument when it comes to food fortification, and frankly, when it comes to government regulation of nutritional standards. The first is that consumers need not necessarily be aware of what might be healthier or unhealthier. That can be the role of government regulators. Let me give you the example of trans fat. Most governments around the world have now put in very strict regulations on the levels of trans fats in food products. Why did they do that? Not necessarily because there was demand from consumers, but rather because those government evidence from highly reputed sources thought it was good enough to take a regulatory stance. And so the awareness from the consumers was not required. The government took that step as sort of a public good. So that is one sort of argument that people tend to have. I'm not saying where I personally sit, but I'm just sort of sharing the two arguments. The other side of the argument is that, well, if consumers were aware of the issue of anemia and the benefits of fortification, then they would demand this from the government in terms of regulations. And they might also demand it in terms of going to the shops and putting the money where the mouth is and purchasing the fortified products. So there are these two lines of argument, and there's a lot of debate about which one is more viable than the others. Frankly, I'm not going to put my personal thoughts on the table here. I think both have a lot of pros and, frankly, cons about them. I think the second part of the question is perhaps not more interesting, but pretty important here. As an organization, we're currently running a pilot on consumer awareness. So we've got about 25 retail stores in a state called Madhya Pradesh, where we've put up promotional materials, and we want to see, does this drive changes in behavior? My personal, very skeptical view, however, is that it's not really a nonprofit's role to drive large-scale awareness of public health issues. It's incredibly cost ineffective. Not to mention, is this really the role of a nonprofit organization in a country the size of India? I suggest probably not. If we could persuade the government of the issue of anemia, and to a large extent, the government of India already recognizes anemia as a major health challenge, can we support them in designing interventions that they could then distribute through government channels to raise awareness? And I think this is the sort of intervention path that I personally feel more excited by, and I think probably is more aligned with an organization our size in a country the size of India. But I do want to highlight these are personal views, and we are experimenting on this right now.
Mhm. Thanks, Tony. The next question we have is from Sakshi Mohan again. The question is your long-term objective to make yourself irrelevant as an organization and have sustainable institutions take up the work you do? Seeing nods, how does that resonate with the organization's staff?
I think all nonprofits, this should largely be our purpose, is to make ourselves redundant. Every organization has a mission. If we can reach that mission complete, either we're going to find a new mission or we pack up our bags and go somewhere else. And I think if we could get to that point from an internal staff perspective, what an amazing thing to be able to say. That is something which you can look back at the end of your career and go, wow, we did something. So for me, I'm not concerned about keeping myself in a job for as long as possible and being paid a salary. I think sadly, there are still lots of problems and challenges in the world. If we could get a policy change and implement it effectively, we would happily move on to something else or see if there are other ways that we can help.
Yeah, that's actually a very inspirational answer, Tony. That feels like the right spirit that feels like the right direction for most nonprofits represented here. So moving on to the next question by Felipe Acero. For partnerships work, even if cost ineffective, how are you reporting progress on this to donors or the general public?
Yeah, so maybe to clarify, we do still measure some level of cost effectiveness with our partnerships work, but that tends to happen once we're actually implementing on the ground. So there's a long fixed cost, internal fixed costs in building relationships with governments, with key actors, and it's very hard to measure all of that. But once we start implementing, once we start supporting, it becomes much more measurable. And what we've observed is that the cost effectiveness once we start implementing is often orders of magnitude better than our open market work, because we're reaching a much larger population, tends to be better targeted, and often the government is paying, and so really becomes quite cost effective. So that's part of the answer. But in terms of how we also measure progress, within the political system in India, there's a pretty standard set of gates that one needs to go through to have any type of policy change. There's engagement with key actors within the bureaucracy. Then there tends to be letters or memorandums of understanding, MOUs, that get filed and signed. Then there's often cabinet level changes, a policy change, and then, implementation of that policy. And so we're also able to measure progress through these various gates. And I think in many countries, there are similar styles of gates. And so that's how we also hold ourselves to account. Are we actually making some level of progress? And also how we report to funders and donors.
Time check. We're doing great with time. We have 15 minutes left, and I think I can get to all the questions in our swap card. So far I'm seeing four more. So yep, let's move on. The next one is by Puneet. Puneet asks, could you please elaborate on which major private companies you partner with to ensure a stable supply of fortified wheat health? Stable supply of fortified wheat flour. Additionally, what are the key challenges you foresee in achieving long-term nationwide 100% wheat flour fortification, similar to the success of iodized salt?
So I won't be able to answer the first question. That's sort of private information for the companies themselves. So we support some 250 millers. They then sell their products through their existing name brands. So in this forum, I won't be able to share specific brand names. But in terms of the second part of the question, what are the key challenges in achieving long-term nationwide 100% wheat flour fortification? That's not necessarily our goal. We as an organization also see there as a value in consumers having optionality between purchasing fortified and unfortified products if they wish. In a similar way that one can purchase uniodized salt if they wish. Really, our goal would be for the status quo, the normal thing to purchase to be the fortified product, similar to salt. Most people, without thinking, buy table salt. It's iodized. They don't think about it. That's great. Some people do think about it, and for whatever reason, they make the decision to purchase unfortified, and that's totally fine. So maybe one clarifying part on that. But to answer the substantive element of the question, what are the key challenges? The first challenge that we see is quality. When we're talking about wheat flour, you have to imagine that the products that this wheat flour makes, rotis, chapatis, and naans, are the core caloric element on the plate for these individuals. And just like you probably have some pretty strong preferences in that core item on your plate, be it noodles or rice or the source of vegetables, these individuals also have some really strong preferences. And if they don't believe that this core staple is high quality and up to standard, they will shift. And it's very hard to get people to shift back. And so I believe that quality is the utmost item here. We're talking about people's day-to-day core food staple. We need to ensure that the fortified alternative is as good, if not better, in terms of quality than what they already have. In order to get that quality right, there are a whole bunch of things that need to go right. And I think one key part of that is ensuring that the regulations and the government's administration of those regulations is high quality as well.
And then moving on, we have two questions about widening the geographical targets. So the first one is by Siddharth. Again, Siddharth asks, are you looking at widening the scope of products to fortify, especially to reach populations that aren't high flour consumers, like regions in South India with rice-rich food habits?
No, we're not. And the core reason is that these interventions are not neglected. So coming back to that ITN framework, there are many organizations doing phenomenal work on rice fortification, oil, milk, and salt fortification across India. And that's part of the reason Fortify Health was set up with a very narrow intervention, wheat flour fortification, because that was what was neglected. So right now, we are not planning to support rice fortification because frankly, it's just not neglected. And we are strong believers that in the nonprofit space, we should focus on collaboration, not competition.
Great. And just a quick alternate prompt from another audience, Rishi, who asked, how much more room do you think y'all have to grow? How much room do you think you have to grow, at least within India? Could this scale to other geographies? Maybe you have a alternate reaction to that.
Yeah. So while 12 million, 13 million beneficiaries on a monthly basis is a huge number. I'm from a country, Sri Lanka, with 25 million, so 13, and then I grew up in Australia. So 13 million people for me is a massive number. But in India, a country with a population of 1.6 billion people, 13 million is a drop in the ocean. I'm sitting here in the city of Delhi, which metropolitan area has some 30 million plus people just in the city that I'm currently living in. So sadly, in India, it's estimated that 400 million plus people suffer from anemia. We are reaching 13 million. There is huge, huge, huge scope for us to continue expanding our work. In saying that, we feel reasonably confident at this point that we have a proof of concept that can work and has been growing extremely quickly over the last year and a half in particular. We've more than doubled the number of beneficiaries we reached in just the last year. So we are in the very earliest stages of going through the ITN framework to think about what other geographies may be appropriate for us to support. I don't want to say any geographies right now, but we have started a weighted factor analysis model, if that means anything to anyone here. We've got a very complex weighted factor analysis model to determine potential geographies for the future.
Yeah. Yeah, Tony, I'm seeing that there are a good number of like curiosities about I'm seeing a good number of curiosities about cost effectiveness. So we're I'm also seeing so the first question by Burke, Salik asks, when evaluating cost effectiveness, should we think differently about interventions funded by high opportunity cost sources like open fill, give well, versus low opportunity cost sources like government grants or CSR budgets? How to think about some funding sources that will enable scale but damage cost effectiveness?
Yeah, great question. And I think for me, this comes back to the doer and payer at scale. There are some interventions where philanthropy could feasibly be the payer at scale. But maybe to double click on that, what type of philanthropy could truly pay for a certain type of intervention at scale? Now, it's true, a coefficient giving or a give well can pay for a certain type of global health intervention at scale, as we've seen with bed nets, for example. They are a few of them. I would say that most health interventions are probably not appropriate for such philanthropic sources, but some do exist. And so thinking about that early on, I do think is quite important. If the funding source for your intervention is likely to be one of these low opportunity cost sources, as Berke shared, then I do think it's important to think about the intervention. Because at scale, CSR in India is probably not going to be able to pay for something like fortification. It's just much too expensive for CSR. Not just expensive, there are a lot of practical challenges as well. And so perhaps CSR funding is better suited to supporting policy work and partnership work. And so I think in this way, money is not always fungible. While it might sit in our bank account and all look like the same rupee or pound or dollar, the source of that funding does influence a lot about how we think about what we use that funding for.
And Tony, finally, we're at the last question here. I don't think that new one's coming in, so we can end it comfortably here. So a follow-up question to cost effectiveness again. Judith asked, could you share an estimate of how much more cost effective you found or modeled partnerships work to be versus the open market work?
So it's a very wide bound. And the reason it's a wide bound is that the level of support that we provide to a government partner varies hugely. We can provide a very cost-intensive support, often for something like a small pilot, which might have an impact evaluation around it, but could unlock a massive policy change in the future. Or at the other end of it, we could provide just pure technical support. And that's like a euphemism for support the bureaucrat. You have one person, they support the bureaucrat, you reach a couple of million people. We have found that we are anywhere from about half as cost effective to about 10 times as effective. And so it's a massive, massive bound between those sort of two poles. But if we could have a policy change, which is sort of our long-term vision, then it is very viable that we could be on the upper end of that, just providing technical support, because the government has plenty of capacity to provide health interventions at scale.
Great. We're at the end of this talk. For those who want to continue this conversation, Tony will be available for office hours starting in 4 minutes in Get Around. Thank you to your audience for showing up and your lovely questions. Thank you, Tony.
Fantastic. Thanks, sir.
Mhm.